you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join Doctors Joanne and Aaron as they rewrite the rules for women in medicine. Let's begin.
At the time of this episode, it's going to be right in the middle of May, and you may or may not know that May is Mental Health Awareness Month. And so I love the opportunity today to talk with my co-host, Dr. Joanne Sotelo, psychiatrist and coach, and talk about some of the issues about mental health and specifically how they may be affecting our listener and women in medicine. Joanne, I'm so excited to explore this topic with you, even though it's one that we oftentimes go back to because it is so important. And I'm wondering from your perspective, what's the most important things that we should understand about mental health today?
Yes, Erin, thank you. And of course, mental health is my passion, having been a psychiatrist for more than 2 decades, and actually went to medical school because I wanted to be a psychiatrist, and I've had this mission of bringing more mental health awareness and prevention all along. So I love every opportunity to talk very specifically about mental health. And even though I can bore you with hours about mental health, I'll go straight to the point in the things that are still so important to talk about, even though we've made a lot of progress in how we talk about mental health and the openness about this topic. There's still things that we need to remember. And I'll start with that one. Is the remembering mental health is health. And it's the foundation of so many of the things that we do, how we feel, how we show up, our results, and then also the foundation for anything else that's going on in our system. And this is shown study after study that if we have improved mental health, even any other physical illness will be better. And the opposite, unfortunately, is true as well. But we still deal with stigma. So that's right. Like my mission that I should have a tattoo about this because it's so important. And then in relation to what we do as women in medicine, that we've talked many times about how we tend to minimize our emotional well-being and just say that we're fine. And again, we need to remember that this is part of our overall health, and that, if we're not healthy, we really cannot do what we do. So that's always first thing that I'll say over and over and over. The other thing that I like to think about is that mental health is a spectrum. Of course, as a psychiatrist, I see people who then struggle with more symptoms and their day-to-day is affected and it affects their functioning. And that maybe it's one extreme of what I see, but then understanding that it's not, I have mental health problems or not. It's part of our overall well-being, and it's not binary. So that it's right. And in a way to think about it is keeping ourselves in check, right? Like we love sharing tools, and there's 2 things that we can do that bring a lot of awareness and prevention within ourselves. We can ask, from the scale of 1 to 10, how am I doing today? And even better than that, we can ask ourselves, how am I feeling? And I shared this before, that it's been shown that just asking ourselves that question, and please don't answer it with just fine. Yes, you might start there because that's what's ingrained in your brain, but try to get a little bit more detailed. And then we know that awareness, that checking in can be really good for your overall mental health well-being. Another important point, especially for us in this podcast, is understanding kind of the spectrum that a lot of us women in medicine go through of the stress that we deal with on a regular basis. And then when it becomes more chronic and toxic, and then the burnout spectrum, and then of course, then thinking about it more from the standpoint of mental health. And that those are all different things, but very all important for us to talk about. And then the distinction here is that just because they might be common for us doesn't mean that it's normal. And what we always say, that it's important to say things out loud and ask for help. And of course, bringing it back to how important it is for us so many of us are physicians, to really prioritize our mental and emotional health. We definitely need to do a better job at this. And I always say that with the numbers of anxiety, depression, burnout, even suicidal ideation, those high numbers in medicine, I should have more patients who are physicians. And I don't. And the unfortunate reality is that even though we're so good at recommending care and taking care of others, we're not always doing that for ourselves, which is one of the reasons I also love coaching, because even though it doesn't substitute therapy or psychiatry, it can be a way to promote health-seeking behavior. So, just you listening to this podcast is a good way to start thinking about this. But the reminder that we have to definitely prioritize our mental health.
We've talked about non-negotiables in several episodes, Joanne, when we're talking about trying to help our overall well-being. And I wonder, what role does prioritizing mental health for women in medicine? Why is it such a priority, or why should it be a non-negotiable?
We talk about this also, how when we struggle, we tend to go inward and we struggle in silence and we don't ask for help. And just being aware of where we are in that mental and emotional well-being and prioritizing it can also get us to be more open and create that connection and community that's so important for our mental health. And then I'll repeat again, we have to break the stigma. And I know that there's a lot of things that reinforce this, right? Like we can be ashamed, or we feel like we're broken. We feel like there's something wrong. And we need to normalize that there are struggles, and we wouldn't hesitate if our pancreas is not working great and our insulin is high and we're at risk of diabetes and we start having symptoms. We don't hesitate to seek help. If we have chest pain, we don't hesitate. But yet when we're struggling, when we're sad, when we're worrying excessively, when we sit in that hopelessness, we turn inward and then we wonder what's wrong, or we have those shoulds. Like, I should be able to figure this out. And there's the expectation that as women in medicine, we have to have it all together, and right, like that silence that can lead to suffering and into isolation. So, I keep on repeating that because we can change so many things by not staying in silence, seeking help, breaking the stigma, and bringing it also into community. I love that I've been going to more medical conferences where we talk openly about mental health and what are the what's the help that's available and the resources, and not waiting until you're in that point when you're in horrible pain to seek help. And of course, like we've shared so many times, we are at a higher risk of depression, anxiety, burnout, even the worst outcome of suicide. And it doesn't need to be this way. Some things are out of our control, but it makes it even more important for us to show up for ourselves for the things that we can control for ourselves. And then also the ripple effect it creates, and the role modeling. And one of our favorite words in this podcast is awareness. And that is always that first step into prevention. So just us having the conversations as women in medicine, normalizing it, sharing openly. When one person is vulnerable, it gives opportunity to someone else, see ourselves in each other, and really connect and heal and seek more professional help if needed, of course.
And I love that you share some trends you're seeing about people at medical conferences being willing to share more openly about, I'm assuming, mental health struggles. I remember vividly the first conference or the first retreat that I hosted back in early 2020, right before the world shut down. Many women, healthcare providers that were present, sharing, yes, I have mental health struggles, and I would never take the risk of seeking mental health. And now it's some of those individuals who said that very thing, I know have sought out mental health, and others finding it a little more acceptable, being forgiving of themselves and recognizing that they won't be able to fully serve the patients that they want to if they don't fully care for their own needs. And as you said, that mental health is health. And so how can we ignore that aspect? How can we get beyond this stigma and also be part of the change? For example, states making changes to their board certification or their licensure questions, asking about changes making changes in the questions about mental health, not just have you sought mental health support, but is it affecting your ability to be an effective physician or healthcare provider? And it's exciting to me to see that there's more and more momentum to safeguard that aspect of our health that's so necessary, and seeing some of those trends changing. And I would love to hear from your perspective, what are more practical steps that we can take to protect and strengthen our mental health and well-being?
So when we know better, we have to do better. So if you're listening to this podcast, now there's a sense of responsibility that you have to start talking and keep talking. We have to normalize the conversation. That's my first thing that I'll keep on saying over and over. And again, the same way that we talk about how our knee hurts when we're walking uphill, then we can start asking things like, how was this week? What was good and what was tough? So even with simple questions like that, we can start the conversations and normalize that we all struggle, and that sometimes, of course, that's also a spectrum, but open that space where we can share openly and vulnerable without fear, without it feeling, hesitating so much. So, and then what we're doing, if you're doing something about it, if you're saying like, I reached out to a friend, I reached out to a coach, I talked with my therapist, that's also part of the conversation that we need to normalize. I love hearing more and more about that. This sounds funny, but the second tip that I'll say is prioritize emotional hygiene. And like I say, we have to go back to basics of sleeping well, eating well, getting some sun, and doing things of mindfulness like gratitude, and then kind of checking in on your energy tank. Like I love to say, capital E energy, your mental, emotional, physical, spiritual energy. So just checking in again can be very powerful. And then say, I didn't sleep well last night. What can I do tonight to make sure that I catch up a little bit? Or I was on vacation and I was eating more than normal and maybe having more alcohol. How can I recover from that? Or I haven't worked out in a while. Let me walk outside, get some movement. And even though it sounds very cheesy, mindful things like journaling a little bit and getting connected with gratitude, those are all things that we can absolutely do. We need to check in when our brain gives us all kinds of excuses like, oh, that's too hard. I don't have time for that. Or you don't understand. Some of these things just can take a few minutes and can create a very dramatic change, right? Like that 1 millimeter every day. I think something also specific for us women in medicine, we have to challenge that super women narrative. I know that's been part of my work of, I always joke that I have to remind myself that my hours don't have 120 minutes, right? Like my to-do list should not have 24 items and then have the expectation of doing all of them every day and then taking care of everyone else. It's then reminding ourselves like, I'm worthy of support. I don't have to do it all alone. It's okay to not be okay. It's okay to delegate. All those things that make sense, but yet there can be so difficult for us. And then let's help each other out more, really. Like we talk so much about that here, the power of community. And, Erin and I do that with each other. I love that we have these times when we have scheduled to record And then we can leverage that to, I know I'm going to be happy because I'm going to be seeing my friend and we're going to talk about what's going on and we're going to check in. We need to do more of that because, every now and then we're like, we can share, it hasn't been that easy and we can support each other and we can share resources and do it again without judgment, but rather a lot of compassion.
We've covered a lot in this episode all about mental health during this month of May, Mental Health Awareness Month. And I'm going to do a quick summary here of so many great ideas that you shared, Joanne. One powerful one, mental health is health. And that there's a spectrum on how minor or significant that we might be having issues, and that there's still a lot of stigma, shame, feeling broken. And how can we normalize having conversations about issues in mental health the same as we would if we had pancreatitis or a fractured leg? And also that the importance of mental health you shared is important to our physical health. And that if you're dealing with physical issues, if your mental health status is healthy, then the physical health issues will also improve. You shared about awareness and what you don't know, you can't change. And so that awareness about how am I doing, getting curious, spending time, I think, with ourselves without all the interruptions and distractions is so rare for us. And women oftentimes because we're so busy caregiving for everybody else. And if we can recognize it sometimes as, is it too scary to dive deep into what's going on with ourselves? And I don't have to do that if I'm so busy focusing on everyone else, and just being aware of even that. So raising our awareness, asking ourselves questions. And when that awareness is raised, can you then make some changes and figure out what's going well, what you might be able to change? And then also taking an assessment of your energy tank, mental, physical, emotional. And I like to use the term recipe. What's the recipe? What are the leaks that are going out? What's coming out of that energy tank and what's going in? And I love, Joanne, how you shared that if you recognize, I had a bad night of sleep last night, what can I do in order to make up for that so that I'll feel better tomorrow or later today? And it doesn't have to be complicated. Sometimes we make, I won't be able to get 8 hours of sleep. Okay, could you take a 5-minute nap? How can you lower that bar to make things get a little bit better, 1% better, so that it doesn't have to be an all or none thing? But can I add one little tiny bit of goodness to go back into that tank, especially when we recognize that we've got big leaks in that tank, whether that's with complex patients, with your own health, with your own circumstances. And then the power of community, Joanne, so beautifully said, that we need to help each other out more. So important. And when we've talked a lot about being alone versus being around others that can share like experiences. And I know you and I both do that with our group coaching, with our retreats that we host for women in medicine. And we've commonly said, if you don't have that community, go find it. You can check in with either one of us. Find a community. You don't have to create it yourself. There are communities out there that are going to help you not go through whatever it is you are going through alone. And Joanne, I bet you have another piece of wisdom to share with our listener about the importance of addressing mental health.
What comes to mind, it's a little bit more of a challenge. I'll repeat something that I said, and asking yourself, how am I today? And something will come up into your mind and honor it. But then I want you to pause and then say, no, how am I really doing today? And sit with it and see what comes up and check in, give it a word, give it a name, and practice that on a regular basis. You'll be surprised of what comes up and actually how you'll end up feeling better with some time. And if you can share with someone else, even better.
I love that practical suggestion. Thank you so much, Joanne, for sharing about Mental Health Awareness Month this May. And in our next episode, we're going to be talking with Dr. Tamberly Conway, and she's going to share how we can use nature to boost our mental health, even in small enough increments that busy women physicians and busy professionals can fit into their day. So don't go anywhere. Stay tuned for the next episode. It's coming right up.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.